Hey docs, Dr. James Fetish here, drjamesfetish.com, coming at you from our clinic today. We just got out of our weekly staff meeting. If you're not doing a weekly staff meeting, you need to do it. I've had coaching clients tell me they're too busy when we see more patients in a day than they're seeing in a week. We'll see 100 patients in a day, they're seeing 100 in a week, and they cannot fit into staff meetings. So you got to block the time off and have weekly staff meetings for one. But we just did a referral training, so we had a whole hour on basically staffing and brainstorming on referrals. I just did a J. Abraham referral program that was really pretty interesting, but it's a way to think a little bit differently about referrals. I want you to think about in your clinic. So think some questions that kind of Jay's program brought up. So, first one is, what are you really selling? So what are you really selling to your patients and practice members? Are you selling healthcare? Are you selling health, wellness? What exactly are you selling to them? And then on the flip of that, what are they actually buying? So one of the things I always talked about, especially when I bring in young associates, is nobody's really coming into the clinic for what you think they are. It's really not even pain relief. That might be up there, but the number one reason most people come to see you is they're missing out on doing something. And it is picking up the grandkids, it's doing their CrossFit, hitting a golf ball, something like that. That's what they're really missing out on, something they're not able to do anymore. So that's what they're really looking for. The next question you got to think about referrals is, who are your competition? Who are your competitors? And we're always going to think of the chiropractor down the street, but that's really the least of your worries. It's the medical doc, it's the PT clinic, it's the Ben Gay commercial, it's the at-home traction machine. There's all sorts of other competition we're not even thinking about. So once we realize our competition, we want to think about, what do you do better than the competition? So for us, it's convenience. We're open a lot. We don't have long lunch breaks. We're here 9 to 7 every day. Multiple chiropractors. We can always take a walk in, those types of things. And you also think, what does your competition do better than you? One thing we came up with, we don't do weekend hours anymore. We gave them up after years of Saturdays. We don't want to do them anymore, so we're not open weekends. And there's people that are. So obviously that's something they're better than us. And then another really important thing, we go through this in our Ultimate New Patient Marketing Machine course, is what's your ideal customer? So you really need to spend some time thinking about this. We do the avatar in our Ultimate New Patient Marketing Machine. Spend some time, who do you really want as your ideal patient? So it might not be who you're treating now. We came across in our office, our meeting, which is going to be most offices, the average chiropractic patient's a middle-aged female, 45-year-old female, upper middle class, athletic, somewhat athletic, still likes to exercise, yoga, workout, that kind of stuff, and you get into more detail there. But then you want to make sure you're marketing to that person, so it's a really key thing to do. So what does the ideal customer want? So we came across, it's a 45-year-old mom with 2 kids. Do we have enough kids area, playthings for the kids? Do we accommodate the children? Do we have a changing table in the bathroom, which we do? So think of things that you can do to make your ideal customer happy in your clinic. So then at the end of the exercise, basically come up with 3 ways to make things better for your ideal customer. Is it a kid zone? It's play area. If it's seniors, maybe you need to build a ramp or something like that. So what are 3 ways you can help your ideal customer? So one thing a little bit differently about referrals, also some different sources of referrals. So when we talk about referrals in chiropractic, we're usually thinking about patient referrals, right? But there's other types of referrals. How about vendors? We just talked, we have a shredding company comes every week. How about they send us some people? Other doctors in town, the customers, obviously staff. We tell our staff it's really part of your job description of bringing referrals. That's going to come up at your semi-annual review. Do you bring in referrals to the clinic? Your expected grocery store, Walmart, wherever you are, to see people with back pain and bring them in. So staff, customers, vendors, big one vendors, and your competition. So we went through competition. How can our competition send us in some people? Is there physical therapy down the street? Yeah, they want to keep the back pain, but they don't do headaches or something like that. Or the medical doc, when some of the referrals we get from MDs are, they tried everything, nothing works, go to the chiropractor. Or, my back's out, but I hate medications, what can I do? Here's my chiropractor, that types of things. Another big one, groups, churches, associations. Is there a mom's group, a church down the street? All kinds of different organizations that can help out as well as send referrals. So I want to think a little differently outside the back of referrals. Think about your ideal customer first, and then where are they going to be going and where can you get referrals from down the road from there. So hold this out, think about some different ways to get referrals into your clinic. For more information, go to add20np.com. That's a free webinar on how to add 20 extra new patients per week to your chiropractic, 2 per month to your chiropractic practice. It's a free webinar in the world trenches for a multi-million-dollar practice owner on how you get more new patients in the field today. Hope you all have a great day, and we'll talk to you soon.